Hello, my friends. This is Dr. Diana as patient, and I am pretty ill. Well, I just made it back from the 17th annual conference for mast cells and mast cell disorders in Boston. It was put on by the Mastocytosis Society. Now, you know me, I'm always recommending their website for information and doctor appointments. That website is tmsforacure.org. Love them. Lots of notes too, huh? Now, if you or a loved one are dealing with one of our family of neurological disorders, including but not limited to EDS with POTS or dysautonomia, multiple sclerosis, chronic fatigue, fibromyalgia, chronic Lyme, and even Alzheimer's, heads up, everyone. I'm sure you know by now that part of the Driscoll theory as to why the heck we are so sick includes mast cell involvement. I believe much of our conditions stem from poor blood flow and cerebrospinal flow secondary to mast cell activation. I believe that many of the mast cell mediators cause our vessels to weaken and become leaky, usually by changing their collagen from collagen 1 to collagen 3, just as what occurs in, say, varicose veins. Do you want to see the collagen changes? Here is a sample picture of collagen 1. And here is a sample of collagen 3. I'd like to thank Dr. Gabbiani and Dr. Scafani for those pictures. Did you see the difference in those? Okay. I humbly believe that anyone with one of these chronic conditions owes it to themselves to explore the possibility of mast cell activation syndrome or systemic mastocytosis. You can learn much of this information about mast cell disorders from my videos, or you just go directly to the source, tmsforacure.org. I do have lots of handouts and etc. on the website too. So many of you, excuse me, know that when I spoke at the second annual CCSVI symposium in New York and at the very recent International CCSVI Society meeting, I explained my thoughts on mast cell involvement and increased intracranial pressure in multiple sclerosis. One of the doctors involved in the International CCSVI Society is responding well to treatment for his multiple sclerosis utilizing the Driscoll theory. Now, he already had CCSVI angioplasty before I met him, but is now taking acetazolamide and mast cell medications with great results and is encouraging many of his patients to do the same. That is pretty exciting, isn't it? Now, okay, true story. The doctors met the evening before all of the real work began, right? And this doctor asked if I'd be able to complete my talk within 20 minutes. I reassured him it would be no problem. I can whiz through this thing. He suggested, though, that if time was tight, I could take out, say, the slide dealing with mast cell involvement. I kid you not. The mast cell slide, oh no. I said, that is the heart of most everything. Then I noticed he was flushing when he drank his red wine. So after giving him a very hard time, he went on acetazolamide and loved it, and then mast cell medication and loved it. The next thing I knew, we were having lunch at the Mastocytosis Society meeting. Okay. Now, if you have mast cell disease, you likely know about trigger avoidance, right? This is the funny for the day, my friends. After getting on medications, he said that he couldn't believe how much better he felt when he drank his red wine. I kid you not. So now he and I must have the talk about trigger avoidance. But I love the fact that he and so many others are responding well to treatment via the Driscoll theory. Stay tuned for part 2 of the Driscoll theory, where all of this will be explained in great detail. I'm completing a couple studies before I let out part 2. Now, by the way, PowerPoints of my presentations have been available on my website, prettyill.com, but they haven't been exactly really easy to find. I am going to add the audio to them so you can see and hear what was covered, okay? Mast cell treatment has certainly changed my life and the life of my son and daughter. For all patients out there with children who are suffering, I understand how it can rip your guts out. My son was triggered by a virus, then another virus, then another virus, as was I, but he was only 8 years old. He and I have EDS and POTS, as does his sister, but hers is much more manageable, knock on wood, but you know how miserable it can be, right? Well, one day before we started treatment with low pressure lowering medications and mast cell medications, when he was lying on the bathroom floor and sort of writhing in misery, he said he didn't know how to keep living like that. He didn't know if he could take even just one more day. He's 8 years old. As a parent with no real answers, what do you say to that? Well, personally, I got down on the floor with him. I looked him right in the eye, and I reassured him that I understood exactly how he felt. I would always believe him and be with him on this journey every step of the way. I promised him that I would do everything possible to figure out what was wrong with us, and I would never give up, and I haven't. Now, because I knew so many people who were diagnosed with both MS and EDS, and because if I felt I was also headed that way with a right-sided tremor and that right-sided heaviness, I hit the multiple sclerosis research pretty dang hard. I compared notes and learned so much from many of you, my brothers and sisters. I remember on Tim's, I love that forum, when we were all comparing our funky vessels, saying that something was missing, something big with our vessels getting missed. That's when I started researching anything that could make our vessels leakier and more stupid. Stupid, really. It's as if the vessels just went, duh, they forgot what to do. So I was looking for a correlation between leaky vessels and a leaky blood-brain barrier. And this is how I suspected mast cell activation syndrome. I learned at the conference, by the way, they're not calling it MCAD anymore, mast cell activation disease. It's called mast cell activation syndrome. So science is changing quickly. We'll stay up with that. Yeah. So the conference, okay, Mast Cell Conference. I was incredibly impressed with Dr. Castells. What a great mind she has. I met many doctors on disability with this condition and heard there were at least 5 anesthesiologists on disability at the conference as patients. What is up with that? There was a great deal of discussion about systemic mastocytosis and the rarest form of mast cell disease. It's an aggressive, malignant, and deadly form, not unlike cancer, usually kills within 6 to 12 months, horrifying. But fortunately, that is very rare. MCIS, however, is not rare, and the majority of the people I get to work with seem to have MCIS, which is easier for me to handle. Now, much of what I learned at the conference occurred with groups of the patients who met after the sessions. I met quite a few POTS and EDS POTS patients, MS patients, patients who were triggered with Lyme disease. Do you see the trend here? There's a little pattern, huh? Now, interestingly, doctors that were speaking sort of dodged the questions concerning the links between our conditions and MCIS, even though we know they're working on the connections. At the breakout session for MCIS, for example, there was this interesting mix of EDS, POTS, chronic Lyme, MS, patients with poor immune systems, chronic fatigue, etc. The only thing that we could figure out was that perhaps the doctors didn't want to speak about it without completing their studies first. And that makes sense, because it was sort of funny. It felt like the patients knew the correlation, but publicly the doctors weren't admitting to anything. But I completely respect the need to have complete studies run first. This was, after all, a conference in celebration of the Center of Excellence for Mastocytosis at Brigham and Women's Hospital and Dana-Farber Cancer Institute. All I can say to the doctors is, bless you for your work. Tremendous. Now, the other thing, symptoms, I think I just run through them really quick. For mast cell disease, they include, but they're not limited to, flushing, urticarial pigmentosa, telangiectasia, chest pain, nausea, vomiting, diarrhea, abdominal pain, bloating, fainting, elevated blood pressure, low blood pressure, angioedema, bone pain, shock, anaphylaxis, osteoporosis, fatigue, weakness, forgetfulness, and cognitive difficulties. Does anyone with POTS out there relate to any of these symptoms, I ask? Now, I'll go into this in much more detail soon. Okay, I'll actually define some of those terms I just threw at you. So my friends, I continue to learn and research and write for you. Let's continue to change our world, one brain cell at a time if we have to. Gentle hugs to you all. Hello, my friends. Oh, let's try that again. That was nasty. Hello, my friends. This is Dr. Diana as patient, and I am pretty ill. I cannot stop this. It's Mast Cell. Okay, let's try again.